I got to tell you, one of the things that I hear the most about for my patients on aromatase inhibitors is muscle and bone aches. And they come in shaking their head and saying, "Oh, Dr. Harness, what can I do about this?" We do know that one of the major side effects of aromatase inhibitors is in fact, bone pain, probably related to some of the calcium loss and the activity that goes on in the bone secondary to using the aromatase inhibitors. Now, the good news is there are different kinds of aromatase inhibitors, and some have more symptoms than the other. And so, frankly, what my medical oncology colleagues are doing is basically trying the different kinds, from, let's say, Femara to Aromasin to an Anastrozole, and trying to see, trial and error, which gives the fewest symptoms. If the symptoms persist and really, in my experience, become intolerable for the patient, then going back to good old-fashioned tamoxifen is one of the things that many of my medical colleagues will do. So it's a question of trial and error. Now, we received a question recently from somebody who has stage 3 breast cancer, really concerned about the aches and pains she was having with her particular type of aromatase inhibitor. One of the things that always goes off in my head is making sure that in fact a specific ache or pain in a specific location is in fact not a bone metastasis. And I know that my medical oncology colleagues think the same thing. And so that's always sort of in the background in our head. So my suggestion always is work closely with your multidisciplinary team, work closely with your medical oncologist, try the different kinds of aromatase inhibitors. If the problems really continue and are intolerable, then talk seriously about tamoxifen. Remember, the bottom line here is really important. You need the anti-estrogen medication. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.